ensure your success by making sure that individuals improve their diet, their sleep, and their exercise.
And now we talk about marketing of reversal of dementia. So regardless of how you feel about the marketing there, largely dementia is not thought to be reversible. There are a few case studies in which there does appear to be improvement, but these are short term. So you're looking at, less than 2 years generally, and you don't know the duration of those effects. And it largely seems to be, looking at all the things people are sort of doing wrong in their lifestyle and then correcting that with a little bit of functional medicine sprinkled in.
Yeah. You want to have basically ensure your success by making sure that individuals improve their diet, their sleep, and their exercise. And then after that, you can add in your proprietary blend of supplements. And that's where you make your money, because you're not going to make money telling people to diet, exercise, and sleep.
Yeah, it's not catchy enough. And I would be interested to see in these studies, and we can kind of go through what they are, but basically looking at these lifestyle interventions. So think diet, sleep, exercise, nutrients, looking at those things, homocysteine, which is, very evidence-based. And then seeing how much of the effect size is from those versus someone who's doing a toxin protocol for mold, or someone who is doing a Japanese knotweed, or someone who's taking an antiviral supplement and those sorts of things.
Yeah, it's hard for the layman or the average individual to parse out, do I need my anti-EBV antibodies checked? Or, do I need my heavy metals checked? Do I need to be checked for tick-borne illnesses? And occasionally you do. In fact, yesterday in our colleague group at Gillett Health, we were discussing, how can we get the best assay possible for testing this individual for tick-borne illnesses. We do live in Kansas, so it is not unheard of. And obviously it depends on where you live in the country. There's different tick-borne illnesses. We don't need to get into that, but that's just one example of someone sees a protocol, or someone sees someone they know, a friend or a family member, that has done a certain protocol and paid a lot of money for it. And they're trying to figure out what percentage of that is the lifestyle interventions and what percentage of that is the herbal supplements or the chelation or the other supplements that they've bought. And it is likely about, between the person, 70 to 95% the lifestyle.
Yeah, I would say at least the lifestyle is doing the heavy lifting. It has the lion's share of the effect here. Some other things they added, ubiquinol. This is something that we recommend quite frequently.
Especially if you're on a statin, especially if you exercise a lot.
Yeah, and this is something that's actually very cheap to test in the blood. You don't need thousands of dollars of blood work to, get the bulk of this sort of a panel that they do in this recode protocol is what they call it.
Ubiquinol or CoQ10, it's something like $15 or $20 via Vibrant, and probably $40 via LabCorp.
Yeah, it's very affordable, and basically once you have your level and you've increased it if you need to do so, it's probably not going to change. Maybe you still check it occasionally, maybe on an every couple of year basis. Just because as you increase in age, you may be sort of seeing that level decrease over time, 5 years, 10 years.
Homocysteine,
$12,
$15.
Same thing, very cheap test.
If it's under 10 and you have mid-normal B12 and folate or better, then you do not need to check an MTHFR polymorphism, unless it makes the clinic that you're going to money. Then check one. Obviously, that's a complete joke, but yeah, we are a fan of checking homocysteines, like you said, evidence-based. We discussed the homocysteine methionine cycle in the past. We discussed methylation, and B12 and folate status. You definitely want to improve those. Many individuals do benefit from a combination of either creatine, which does have evidence in individuals over the age of 55 for cognitive improvement, memory, object recall, I believe, specifically. Also taurine, which also helps in the cycle. Think of it as kind of like you don't need to work that methionine homocysteine cycle as much if you supplement taurine. Also, occasionally things like trimethylglycine. occasional things like L-methylfolate or methyl B12.
Yeah, it's very easy for most people to lower their homocysteine levels. One interesting sort of piece of data that we gathered over this past year is that there are lab errors that occur in homocysteine specifically. If the blood is basically sat there too long and it hasn't been run on the machine in the appropriate amount of time, you will see homocysteine levels very, very high. Yep. So this is what I think has happened in the case where some influencer, ex-influencer gets their homocysteine checked and say, oh, my level was 30 or 40 or 60. It probably wasn't. They should probably verify that very abnormal result. And maybe, in fact, it is high. We've seen them, I think, legitimately at levels of around 20 on the high end. But when someone says it was 60, again, I think that is probably a lab error.
That definitely needs follow-up.
Yeah, it definitely needs to be evaluated and managed if it is, in fact, real.
Over a level of something like 16, it also begins to be a risk of venous thromboembolism. So definitely talk to your healthcare provider about your homocysteine levels.
Now, what about low-dose naltrexone? It seems like anyone with any history of an autoimmune disorder, they put on low-dose naltrexone in the RECODE protocol. This is open access, published. Anyone can go and look at this. So this seems kind of reasonable. Again, if someone had a history of, I guess I'm straw manning the case here, but if someone had a history of Hashimoto's and it was well controlled, they don't have evidence of damage, they don't have positive antibodies at this point in time.
How do you have Hashimoto's without evidence of chronic lymphocytic infiltration?
Maybe they had antibodies at one time.
It's like a little bit of heterogeneous appearance of the thyroid.
Labeled with Hashimoto's by again, it's a lot of times hard to tell where these diagnoses came from, whether this is from a functional clinic. Maybe they're diagnosed by a nutritionist, a dietitian, a chiropractor. Or maybe they were in fact
38.
Yeah. Maybe they were in fact diagnosed by an endocrinologist, and then they were on thyroid hormone for a short period of time and didn't have much damage to the thyroid.
Do they check an ANA to see who has autoimmune diseases? Because I believe over the age of 75 or 80, it's something like 80% of people have a positive ANA.
Yeah, it's not a very specific test.
Rheumatologists love referrals of 80-year-olds with
low titer ANAs.
But yeah, in all seriousness, this is actually a reasonable thing. LDN does have some good evidence for various autoimmune diseases, including Crohn's disease. And you can kind of think of Crohn's disease and inflammatory bowel disease as somewhat like psoriasis of the gut, kind of. Not exactly. But you can look at inflammatory arthritis. Those are pretty similar conditions. So I can make a case that most people with inflammatory bowel disease like Crohn's or UC, and most people with an inflammatory arthritis, especially if they have a significantly elevated CRP, especially if they have dysregulated peristalsis, that LDN will not only theoretically help shift Th1 to Th2 immunity, it'll also help push things through with more normal peristalsis.
Yeah.
Important in older age.
Yeah, and it can be an adjunct as well for people who are on chronic pain medication, reduces the amount of opiates that need to be taken, sort of hitting the reset button on your sensitivity. I guess kind of going back to the published data, pretty unimpressive lab results that are published here. Probably the biggest change here is the HSCRP going from 2.2, which is still considered normal, down to just below 1. If that's a very positive change, that's something that you would like to see if you're looking at your own blood work.
That'd be hilarious if they gave them a flu shot 2 weeks before their pre-treatment CRP.
Just so that it's...
Flu shots and other shots can increase your CRP by about 1 to 2.
Yeah, just like any acute illness can.
And by the way, that's old school protocol to prevent dementia. Used to be getting flu shots, because if you get really severe influenzas, that in and of itself is a huge risk factor for dementia.
Yeah. So let us know what you think about that in the comments. That'll be an interesting one.
We'll leave it at that so we don't get rabbit trailed. But
A1C dropped by 0.2%, so 5.4. I'm just rounding up. It's
definitely not from the exercise and diet changes.
It's a very normal number. And again, they were in a mildly ketogenic diet, so they're going to have pretty minimal glycemic excursions.
Yep. I'm glad they did not do a vegan or a carnivore diet. So props to them for that. That very reasonable whole food diet, essentially.
Yeah, homocysteine, and you would expect higher levels of this at baseline, but it was only about 10.5, and then they treated them to a level of 8.4. Vitamin D, these people were all vitamin D sufficient, which is interesting because if you look at the general population, most people are not. Most people at least have vitamin D insufficiency. But these people started around 41, 42, and they only increased by about 10 points over the study duration. So again, not a huge change. I don't think you would really move the needle much by increasing vitamin D. What's that, about 20%, something like that?
Yeah. That's a good summary. We mentioned several things that, were potentially actionable takeaways: the CoQ10 or ubiquinol, the inositol for some individuals. And a lot of people ask about omegas. In fact, we did just recently do a pretty big podcast on omegas. So thank you for any interaction on that one. But there's also been some, meta-analysis of various studies on omegas, and they're kind of all over the place.
Yeah, and things that I think are great about the RECODE protocol and the studies is that, hey, this does offer a glimmer of insight into what might be able to be optimized and reversed about things like dementia or mild cognitive impairment. What I don't like about it is sort of the monetization of a RECODE branded practitioner. Because these, based on my initial read, are not necessarily physicians or neurologists. This could be anyone that pays for a course. I mean, this could be someone who doesn't even have prescriptive authority. It could be a dietitian or a chiropractor, and then it's like, oh well, according to the RECODE protocol, you need low-dose naltrexone, but that person is not going to be able to prescribe that for you because they're trained, but they don't have full. What am I thinking of? The full scope of practice that someone like a neurologist, a certified physician would.
It's like selling a protocol to rebuild a house. You're remodeling, you're revamping. The house is having dysfunction, and there's a builder, an excellent high quality builder that has a custom designed remodeling, and then it's selling prefabricated cookie cutter custom designed remodeling protocols,
selling the blueprints
to non-builders, non-professionals. So ask yourself if you would want that individual that is using that cookie cutter custom program to remodel your house.
Yeah, which people are still probably getting some insight if they're, putting, I don't know the cost of this, but I think I've seen 5 figures thrown around. If people are that invested, they're probably going to actually make these lifestyle changes.
It's an expensive way to have a better diet, exercise, and sleep.
Yeah. So mixed feelings from myself on that. Some things we might potentially add to this. So Shilajit, I'm going to put on my Mickey Mouse hat here, because in the mouse data, Shilajit, which I kind of think of as a extra layer of like a multivitamin, maybe more specifically like a multivitamin, multimineral for your brain.
Fulvic acid.
Yeah, fulvic acid, preferably a sort of trademarked or extract that's actually been standardized and studied.
Or you can scrape it off the side of the Andes or Himalayan mountains yourself.
Do it yourself,
like the Sherpas do.
If you live in the right area. But it inhibits the formation of these tau tangles in the mice data. And there's one study that supports an improvement in testosterone level, but it wouldn't be my first go-to if I was looking at someone trying to optimize testosterone. Diet and exercise are going to be much larger levers to pull.
Yeah. So again, not really any outcomes data. You love the term outcomes data. I know that. But from a standpoint of you're thinking about like less tau tangles, less NFTs. I had one of my friends who does like cryptos and investments say the less NFTs, the better. So that's what I figure is true with Shilajit. Next is controlling your lipids. So this could mean a variety of different things. I did find it interesting that they touched base on lipophilic and non-lipophilic statins. And that's something that we could really talk about for quite some time.
Yeah. So, there is a small number of people who get side effects from lipid-lowering medications. Most people would stand to benefit, and that's consistent with the meta-analyses and randomized controlled trial data looking at dementia or cognitive impairment as an outcome. When someone, like maybe a particular astronaut, takes a statin and says that it gave them cognitive impairment, probably is the case. I don't think they have anything to gain from making that up other than lots of book sales. But realistically, it is possible that that happens to people. We know that there are unexplained drug reactions, unexplained supplement reactions, and we don't want to completely discredit or gaslight our patients, even if they may be gaslighting us about their blood pressure.
Yeah, that's certainly true. One thing to keep in mind about this is, and I brought this up on the podcast before, is you have those patients and they say, you know what, I just don't want unnatural medications unless it's TRT, which increases your HMG-CoA reductase enzyme, the same one that statins inhibit. So you are on lipid medication if you're on TRT. But, I just want to be completely natural other than HRT. So I don't want any, mitochondrial toxic statins. And if I die, I'll just have a big heart attack and stroke and I'll be fine. And that is tempting Murphy's Law. And the specific part of that is you will never die of a heart attack and stroke, according to Murphy's Law. You will have plaque buildup and ischemic dementia, and you'll have ischemic dementia for 20 years. So if that can be prevented, then it is certainly something that you should consider controlling it, especially if you just have a genetic predisposition to where, it doesn't matter which type of FH you have or whatnot, or lipoprotein little a is arguably a lipid. Controlling that could be an important modifiable risk factor as well.
It's very true. Another thing to get tested, to add to the checklist. Mm-hmm. And we have, optimizing hormones, discussing HRT. This is also involved in the RECODE protocol. Insulin sensitizers, again, they did use some, well, I don't think they did, but I know there's a combination of alpha lipoic acid and omega-3s. One of the positive trials out there for omega-3s and looking at cognitive impairment and dementia. And then copper supplementation. Recently we saw a post. This was associated with increased muscle mass if you had low copper. Is that right?
Yeah, something like that. Again, that's a lot of correlation, but the primary target here is the huge percentage of the population that has had gastrointestinal surgery. And it doesn't matter. It could be bariatric surgery, could be a Billiroth. Yes, the highest risk is if you had a gastric bypass, like a Roux-en-Y or a biliopancreatic diversion, particularly high risk. And Diana and I have also posted about copper insufficiencies and just interesting things that we've noticed with a lot of individuals having lower normal serum copper, but perhaps normal intracellular copper. And then a lot of females that are on contraceptives, skewing that copper, perhaps when they found the reference range, that's what kind of pulled that normal looking copper higher than it actually is.
Yeah, it kind of reminds me of the alkaline phosphatase and maybe having a handful of pregnant patients in that reference population. Mm-hmm. And then inositol. So certain things can affect this, like lithium. Inositol is a known insulin sensitizer. Arguably, if you're insulin resistant, then any insulin sensitizer is going to be dementia preventive. Probably stay away from the sulfonylureas. But other than that, basically, whatever means you're using to improve insulin sensitivity is going to be a net positive.
Yeah. So if you're trying to prevent type 3 diabetes, things that prevent type 3 diabetes make a lot of sense. It's also in vogue to take, again, put on the Mickey Mouse hat for this one. It's in vogue to take lithium, not the lithium caprate, but the lithium orotate, the organic natural lithium. Which I guess it is kind of natural. It is just an element on the periodic table, but it is theoretically going to, or at least preclinically going to deplete inositol levels in the brain cells, probably even at low doses if you extrapolate from the rodent studies.
Mickey Mouse data.
Yep, from the Mickey Mouse data. But that being said, there's not a lot of downside to inositol supplementation. And when we test inositol, it's not unusual to see those with metabolic syndrome have low inositol, just like it's not unusual to see them have, high fasting insulin or low akkermansia.
Yeah, all these things basically, you sort of stack the associations together and try to get as many things in a low risk category or a category that's associated with better outcomes.
Yep.
And one of those things is omega-3s. So basically, I think Framingham data is where this is sort of pulled from, looking at getting an omega-3 index of above 8%. The average person in the population, I think, hovers around 5%. I think Japan is actually closer to that 8%, which, again, there's obviously genetic differences there. It's not just diet that explains these health differences. But it was just interesting to me to look at the variation in the omega-3 trials and their effect on cognition. So actually, most trials showed a neutral or negative outcome, if I'm lumping those together. So it was only 7% of trials that showed a negative effect on cognition.
Yep.
And then 43% of trials showed a positive effect on cognition. But if you look at the range of the number of participants, look at the range of the total omega-3 dose, 79 milligrams, all the way up to 5,200 milligrams, duration 1 month to 74 months.
Yep.
It's hard to make much sense of something like this because there's not been consistent trials done, higher doses, longer periods of time, higher doses of DHA. Tom Dayspring, a lipidologist physician, he posted about DHA and its potential role in ApoE4 not too long ago. So there's a lot of interest in this area still. And this sort of contrasts with the numerous failed interventions where you've had all these trials are either considered to have no effect or even a negative effect depending on the side effect profile.
Yeah. So like anything else, we like to check omega levels, and you don't even need to go to our website for that. You can just go to, I think, Amazon or the Omega Quant website, and you can just order your Omega Quant. You can do the blood spot test, send it back. And and that goes for anything. That goes for CoQ10, that goes for inositol, that goes for B12, that goes for vitamin D. Just stay objective. If it is deficient, then it is very likely to help you to correct that deficiency or insufficiency. And if you're going to splurge, like let's say you're in your 60s or 70s, regardless, you might be having some mild cognitive impairment. Rather than splurging for testing on tick-borne illnesses that you have no risk factors for, but you're just screening that because everybody gets screened for that, rather than screening for various viral antibodies or even, as much as I love stool microbiome testing, even doing stool microbiome testing, as age progresses, you are more at risk of intracellular nutrient insufficiencies. So splurge for micronutrient testing.
Yeah, before you do a Lyme or mold or chelation protocol for heavy metals, that money for probably 99% of the population is better spent on a nutritious diet, maybe someone to plan out your micro and macronutrients, a dietitian, or even personal training, someone who's going to keep you accountable and push you, and you're going to see those improvements. That has a much better bang for your buck compared to some of this more fringe or niche scenarios that may have relevance in some cases, but for most people, you better start with the basics, get things dialed in there, and then you can always branch out.
That's what I'll tell my uncle who worked in a thermometer factory in Lyme, Connecticut. But yeah, hopefully that's a good summary. And we do have micronutrient testing posted on our website. It provides good context, partly just because you see these studies like high B12 levels are actually correlated with dementia. And you're like, well, is that because people who think they might have cognitive impairment take a B12 supplement? Because if you Google reversible dementia, B12 will pop up. Or is it because their B12 is actually on the lower end inside the cell? Maybe they have a higher homocysteine, and B12 is just high in the serum and it's having a hard time getting into the cell. Zinc is also notorious for having this happen.
Yeah, I think those are good things for people to think about.